Okay. Going to show the floor, ceiling, front of the room. Floor, ceiling. Floor, ceiling, the back of the room. Floor, ceiling, other side. Set it back on the cradle. Alright, take it down just a notch. Alright, plug her back up so we don't lose power. Back up. Excellent. Good evening, my name is Rex Gaines. I'm with the University of Memphis Loewenberg College of Nursing, the Family Nurse Practitioner Program for the Spring 2025 FNP Acute Conditions Clinicals. Today is January the 22nd, which is Wednesday. It's 7 p.m. I'm fixing to perform my head-to-toe assessment on my patient Marcus Williams. I'm going to start the assessment by looking at the head, face, and neck, anterior chest, posterior chest, and abdomen, the skin on it. I'm looking for color, temperature, moisture, texture, edema, turgor, lesions, nevi, scarring, and bruises. I'm going to inspect the head for midline position, shape, size, and symmetry. I'm going to start by palpating the parotid arteries for any tenderness. Then I'm going to palpate the lymph nodes. I'm going to start with the submental, submandibular, tonsillar, parotid, preauricular, postauricular, occipital, which is at the base of the head, top of the neck, anterior cervical, posterior cervical, supraclavicular. Now I'm going to palpate the TMJ, temporomandibular joint, for crepitus, subluxation, and tenderness. I'm also going to assess for cranial nerve number 5, the trigeminal. If you would, I want you to clench your jaw, and I can feel the masseter muscle. I'm going to take a soft object. If you would close your eyes and tell me where you feel it.
Forehead, right cheek, left cheek, chair, nose.
Excellent. Now we're going to assess cranial nerve number 7, the facial nerve. I want you to smile real big, frown real big, raise your eyebrows, puff out your cheeks, pucker your lips. Good. I'm also going to inspect and palpate the scalp. I'm looking for hair color, hair texture, hair distribution, depressions, masses, lesions, and infestations. All right, from here I'm going to assess the ears, the outer ears. I'm looking for shape and position. I'm going to palpate the pinnae and tragus. I'm going to use the otoscope to, I don't want to yell in your ear, inspect the auditory canal and tympanic membranes for drainage, blockage, and color. Okay. I'm going to assess cranial nerve number 8, the vestibulocochlear nerve. I'm going to use 3 tests, starting with the whisper test. If you would include your right ear for me. Repeat after me.
A, B, C.
Include your left ear for me.
1, 2, 3.
All right, I'm going to assess for lateralization using the Weaver's test. Tell me if you hear this in one or both ears.
Both.
All right, now we're going to take the Renee's test. 1, 2.
2 is loud.
1, 2.
2 is loud.
Air conductivity is greater than bone conductivity. Now we're going to assess the eyes. I'm going to immediately inspect the lashes, brows, and any palpable fissures. Then I'm going to inspect the conjunctiva and the sclera for color, drainage, and lesions. Next, I'm going to be assessing cranial nerve number 2, the optic nerve, for gross visual acuity, direct and peripheral vision. I'm going to use the Snellen chart, hold it about 6 feet away. If you would include your left eye and tell me the lowest line you can read.
E.
All right, include your right eye. Same.
OLCF.
Excellent. Now, if you include your left eye again, sir, I want you to tell me when you can see my finger.
I see it.
Include your right eye. Tell me when you can see my finger.
I see it.
Okay. Next, we're going to assess for cranial nerve number 3, the oculomotor nerve, for direct and consensual pupillary response. Shine it in the right eye, right eye but looking at the left eye but looking at the right. All right, next I'm going to assess for accommodation and convergence. If you would look at the fire alarm that's right up there on the mantle. All right, now look at my finger, keep looking at it. Excellent. Now I'm going to assess cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens for extraocular movement and conjugate gaze. All right, if you would look at my finger, 6 cardinal directions. Excellent. Now I'm going to use the ophthalmoscope and look for red reflex and other internal structures of the eye. Okay. All right. Now I'm going to go to the nose. I'm looking to see if it is straight and midline. I want you to occlude your right nostril for me and inhale. Left nostril, inhale. Checking for nasal patency. Close your eyes. I'm going to hold a spice under. I want you to sniff. What scent?
Cinnamon.
Excellent. That's testing for cranial nerve number 1, the olfactory. Lastly, I'm going to palpate the frontal and maxillary sinuses. All right. Now from here, we're going to go to the mouth. You would open your mouth. I'm inspecting the teeth, gums, tongue, floor of the mouth, underneath the tongue, the palate, the roof of the mouth, the buccal mucosa, salivary glands, and posterior pharynx. And if you lower your tongue a little bit, you do have your tonsils, and they're grade 2. All right, on that same note, if you'd open your mouth and say ah. All right, I was inspecting cranial nerves 9 and 10, the glossopharyngeal and vagus nerves, the soft palate and uvula rise symmetrically with phonation. Next, I'm going to check for cranial nerve number 12, the hypoglossal nerve. If you would stick your tongue straight out, try to touch your nose, chin, right cheek, left cheek. Tongue is midline without fasciculations. Now I'm going to inspect and palpate the trachea that is midline, straight. I'm going to inspect the thyroid gland. I'm going to push to the right, feel with the left if you'd swallow. I'm going to push to the right, feel with the right if you'd swallow. All right, unilaterally I'm going to palpate the carotid arteries. I'm detecting for thrills, the pulse is +2. Now while using the bell, I'm detecting for bruits unilaterally. All right, Mr. Williams. If you would, I would like you to face that way for me. All right, I'm inspecting the posterior chest. I am going to immediately inspect for signs of respiratory distress, for nasal flaring, tripod position, tachypnea, cyanosis, retractions, the use of accessory muscles. I'm also going to look for obvious deformities and symmetry. I'm going to check for symmetrical chest expansion. I want you to inhale, exhale. All right, I'm going to check for tactile fremitus. Posteriorly, I want you to say 99 every time my hands touch you.
99, 99, 99, 99, 99.
All right, next I'm going to percuss the posterior lobes using the intercostal spaces. We're going to start at the scapula, alternate sides, working all the way down to the posterior lungs, bases, and not forget the right middle. Next, I'm going to auscultate, just normally breathe. We're going to do the same with the diaphragm. All right, we're going to check for egophony. If you would say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
We're going to check for egophony. I'm sorry, bronchophony. I want you to say E.
E, 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 E.
We're going to check for whisper pectoriliquy. I want you to say 1, 2, 3.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
All right. If you would turn back around for me, good sir.
Oh,
Let me just. All right. And just listen to normal breathing while I still have the stethoscope on. Cannot listen to the middle one from here on the right. All right, I'm going to check for tactile fremitus from the front. go ahead, 99.
99, 99, 99, 99, 99.
Tactile ephemeris symmetry. I'm also going to check for symmetrical chest expansion from the front. Inhale. Exhale. Excellent. I'm also checking for any obvious signs of deformity and symmetry from the front. All right, good sir. If you would stand up for me, I'm going to actually, I'm sorry, sit back down. We're going to check the heart. We're going to start with the different areas of the heart. We're going to start with the aortic, which is second intercostal space, left sternal border. The pulmonic, which is second intercostal space, this is second intercostal space, left sternal border. The aortic was right sternal border. Then Erb's point, which is third intercostal space, left sternal border. Tricuspid, which is fourth intercostal space, left sternal border. And then the mitral, which is fifth intercostal space, left side midclavicular line. I assessed it with the diaphragm, now the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. I'm going to palpate for the PMI, point of maximal impulse, and I found it. I'm also going to listen to the apical pulse for 60 seconds. 60 seconds has elapsed. The pulse heart rate was 66. It was normal sinus rhythm. All right, now if you would stand up, good sir. And if you would lay on the table we have here with your head at 30 to 45 degrees, I am immediately going to assess for jugular venous distension. I am going to look for heaves and lifts. I'm going to palpate the areas aortic, pulmonic, Erb's point, tricuspid, mitral. I'm palpating and checking for thrills. I'm also going to repeat with the stethoscope auscultating aortic, pulmonic, Erb's point, tricuspid, mitral, then switch to the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. From here, I'm also going to listen for thrills to the aorta, the left renal artery, right renal artery, left iliac artery, right iliac artery, left femoral artery, right femoral artery for thrills. I'm also going to check the abdomen for contour and symmetry. I'm going to percuss the four quadrants of the abdomen. We're going to do with the right lower, right upper, left lower. And I'm checking for tympany, flatness, and dullness. Tympany was heard throughout with dullness over expected organ areas such as the liver. I am now going to go from light to deep pressure in the four quadrants. However, I would auscultate before I percussed or palpated because that can increase the activity of the bowels. So listen to the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I listened to each for 60 seconds. Normal active bowel sounds were heard throughout. All right, Mr. Williams, if you would get up for me. I'm going to have you face that way a bit. All right, it's a little hard with the camera. I'm placing my hand on the back, and I'm hitting where the kidneys are, checking for CVA tenderness, costovertebral angle tenderness. If I could have you sit back here again, good sir. All right, next we're going to go to the musculoskeletal. I'm going to immediately assess the upper and lower extremities, their overall color, skin integrity, and warmth, tenderness, temperature. All right, now I'm going to start with strength. I want you to push down, all right, push up. All right, I want you to kick out, pull in, push out, push in, grip my hands. All right, push up, push down, push out, push in. 5 out of 5 strength on the wrists, knees, hips, hands, biceps, triceps, and shoulder girdle. Next, I'm going to check for redness, swelling, tenderness, nodules, crepitus, symmetry, and deformity of the feet, ankles, knees, hips, fingers, hands, wrists, elbows, and shoulders. All right. Now I'm going to assess cranial nerve number 11, the spinal. I'm going to push down. I would like you to shrug. All right, now we're going to check for cerebral coordination. I'd like you to do serial finger movements, hand flip-flops. All right, if you touch your nose, every time I say go, touch my finger. Go, 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 go. Finger to finger, excellent. All right, now I'm going to assess the radial pulses, the dorsalis pedal, the posterior tibialis pulses, +2 on each. I'm going to squeeze the thumbs, the index fingers, and the big toes for capillary refill, all bilaterally. We're less than 3 seconds. All right. I want you to close your eyes and tell me where you feel the soft touch on upper and lower extremity.
Right arm. Left leg. Left arm. Right leg.
Excellent. All right, now we're going to go over range of motion real quick. While you're seated, I want you to try to curl your toes, flex them, extend them, hyperextend them as best you can, abduct them, adduct them. All right, now if I can get you to stand real quick, I'm going to roll the chair back. Starting with the right leg, I want you to lift your leg up a bit. I want you to plantar flex, dorsiflex, invert, evert, rotate. Excellent. Now with your right knee, I want you to flex, extend, hyperextend, hip, flex, extend, hyperextend, abduct, adduct, internally rotate, externally rotate, and circumduct. Okay, left leg, I want you to pick up your foot, plantar flex, dorsiflex, invert, evert, rotate, knee, flex, extend, hyperextend, hip, flex, extend, hyperextend, abduct, adduct, internally rotate, externally rotate, circumduct. All right, good. Now, fingers, I'd like you to flex them, extend, hyperextend, abduct, adduct, thumb opposition. Excellent. Wrists, flex, extend, hyperextend, radial deviate, ulnar deviate, rotate. Elbows, flex, extend, hyperextend. Shoulders, I want you to flex, extend, hyperextend, abduct, adduct, circumduct. Good man. All right, if you would, I'd like you to face that way for me. I'm going to inspect the spine for expected curvatures, alignment, and tenderness. And I'm also going to be palpating. I want you to bend, flex forward for me. In the flex position, I'm inspecting for obvious signs of scoliosis. This is also the first part of range of motion for the lumbar spine. If you would, you flex, extend, hyperextend, laterally bend to the left, laterally bend to the right, rotate to the left, rotate to the right. Now cervical spine, if you would flex forward, extend, hyperextend, laterally bend to the left, laterally right, rotate left, rotate right. All right. If you would face the camera for me. All right, I want you to walk forward just like you would normally. All right, now turn around and I want you to do heel to toe. Excellent. Go back up. All right. Now we're going to perform the Romberg test. I want you to put your feet as close as you can together. I want you to put your arms together like a mummy. All right. I'm putting my hands like so to make sure he doesn't swing and fall. 30 seconds has elapsed. He hasn't swayed. Do the exact same as you're doing now, but close your eyes. 30 seconds have elapsed. He hasn't swayed or fallen. I deem him not to be a risk hazard for his balance. So what I'm going to have you do is I want you to jump on your right foot 3 times. Left foot 3 times. Excellent. All right. I'm going to go ahead and have you have a seat again. Okay. Let me see. Deep tendon reflexes. All right, we're going to start with the right tricep. I'm going to go to the left tricep. All right, right bicep. There we go. Left bicep.
right brachialis, left brachioradialis. Actually, let me flip it over. There we go. Right patellar, left patellar, right Achilles, left Achilles. Okay, if I can hold your foot real quick. Babinski reflex. Babinski reflex. Oh, we did not get that. Hold on. 1 second. Let's do the Achilles again. Achilles, Achilles. There we go. Babinski, Babinski. Man. Set back up again. I think that'll be fine. Okay. All right. And that concludes my head to toe assessment for Mr. Williams. Thank you very much.
Thank you, Dr. Gaines.